Mr. Hinkle.
Yes, I would actually just like to pose a question back to the audience. What are we doing overlapping the Medicaid expansion with the Affordable Health Care Act? Currently, under the Affordable Health Care Act, if you will qualify for a good health insurance plan if you earn up to 101% of the federal poverty level. But we're proposing to expand, or the federal government is proposing to expand Medicaid to 138% of the federal poverty level. That's a 37% overlap in the programs. Wasn't the purpose of the health exchange to provide insurance for the uninsured? What are we doing with this extra 37%? And I think it was Oregon, when the exchange opened up, they found more people were actually enrolling in Medicaid than they were in the healthcare exchange. Why would you pay a little bit for health insurance when you could get it completely for free? And so we're talking about we need numbers for the healthcare exchange. Well, Medicaid's kind of competing with that. So what we need really in Montana, we need to focus on the most vulnerable, which currently are parents with children, single moms, and pregnant women. And right now there's about 48% gap, healthcare coverage gap there. And we need to focus on reforms and Montana solutions to cover that gap. And so as far as accepting federal funds, I think the more authority you give to the federal government, the less of an opportunity Montanans have to come up with our own solutions and to enact them. So I would be opposed to that, and I think we can do a much better job here in Montana. Thank you.
Wilmer.
Thank you. I'll consider myself part of the audience in terms of the question just asked, because originally the Affordable Care Act included this part of Medicaid expansion. It was the Supreme Court which overturned that part and said states have to opt in. That wasn't automatic, so that's why we're faced with that. I would support it. I did vote for it last time, and we have a bipartisan coalition of members of the House who were in support of it, in fact. And by one vote, we were able to get it out of the committee, so there is support for that. Look, 11%, the United States, Americans spend 11% more of our GDP on healthcare than any other industrialized democracy. It's just not a good use of our capital for investment to make our economy grow, and we still don't cover everybody. I don't know what the data is on people with Medicaid, but people with Medicare, 92% of them like their Medicare, and any business would be happy to have that level of a satisfaction rate. As for other ideas, and I agree with Representative Woods that these are my federal dollars, and I want them to come back to us. We might disagree over how and where to cut the federal budget, but this isn't a place I want to cut it. I want that money back here for Montanans. So I think we do need to cover that gap of people who are not covered by Medicaid, and they cannot afford and do not qualify for the premiums under the ACA, and that's the 70,000 people left out. And they are working people. They're not people who want something for nothing. They're people who work and for whom that income does not allow them to buy health insurance, and that's why I told you about the first one half of my working life. I was one of those people working 60 hours a week as a waitress in blue-collar, white-apron jobs, and I couldn't afford health insurance.